Hey, welcome to the Healthful Woman Podcast, the fastest growing podcast in women's health. Today's Monday, May 27th, 2024. I hope you are all enjoying your Memorial Day today. And what better way is there to spend a day off than listening to a podcast about urinary tract infections? Seriously, urinary tract infections, or UTIs, are a very common issue, and I hope this podcast with Dr. Sara Kostant will be a helpful one to shed some light on this common and sometimes misunderstood problem. All right, before the podcast, a few reminders. First, The Unexpected, the book I wrote with Emily Oster, is available wherever you buy books. The feedback thus far has been positive, and I suspect if you like this podcast, you'll probably like the book as well. Second, please do continue to email us any questions you might have for our mailbag podcast. To send in questions, you can email us directly at hw@healthfulwoman.com, or you can go to our website, www.healthfulwoman.com, and click on the link that says, send us your questions. Please remember that the questions you send in are for the mailbag podcast, not for personal medical advice that you need answered quickly. If you have a question that falls into that category, please ask your own doctor. Finally, please do follow me on the Instagram. My handle is Dr. Nathan Fox. That's Dr. Nathan Fox. All right, thanks for listening. Enjoy the ad for the book, followed by the Healthful Woman Orchestra. See y'all next week.
Hi, I'm Emily Oster.
Hi, I'm Nate.
Here's a piece of data for you. About 50% of all pregnancies include some type of complication, whether that's a miscarriage, preeclampsia, preterm birth, postpartum depression, or other. I'm not saying this to scare you, but the reality is that we don't talk about these complications very often, and yet they affect an enormous number of people. That's why I've teamed up with Dr. Fox to write a new book called The Unexpected: Navigating Pregnancy During and After Complications.
The Unexpected is a book we hope no one needs to read, but we also want everyone to have access to. It starts by laying out the data on pregnancy complications from first trimester to postpartum. For each one, we try to answer a few questions. What is the risk of recurrence in a later pregnancy? What treatments might lower that risk? And how can you better prepare if it does happen again?
Then we guide you through how to have more productive conversations with your provider. Data will help, but to make these hard talks as useful as possible, you need a script and a way to structure the conversation.
It's important to us that we bring these maternal health issues into the light so that necessary research and policy change can hopefully happen.
And above all, we hope it helps pregnant women feel less alone and more informed and prepared for whatever the future brings. You can order The Unexpected now, wherever books are sold.
Welcome to today's episode of Healthful Woman, a podcast designed to explore topics in women's health at all stages of life. I'm your host, Dr. Nathan Fox, an OBGYN and maternal fetal medicine specialist practicing in New York City. At Healthful Woman, I speak with leaders in the field to help you learn more about women's health, pregnancy, and wellness. All right, Dr. Sara Kostant, welcome back to the podcast.
Thank you. Good to be here.
So we got to schedule this quickly because you got out of jury duty. Congratulations.
Always a great achievement.
Sarah's a big fan of the jury system, but she wanted to defer her time on the jury.
True.
All right.
I'm a supporter of democracy.
Yeah. All right. For the record, pro-democracy, Dr. Kostant. And you would be an excellent juror, I believe. I think you'd make a really good juror.
Yeah, I think I would be. And there's a part of me that's like, when I'm retired, I'd love to be a juror. Like do a nice 2-month trial. Why not?
I don't know. I find they don't tend to like doctors on juries for some reason. I don't know. Maybe that's changing. Every time I've gone, I said I'm a doctor, they're like, go home.
Bye.
Nice knowing you. Maybe that's just in Jersey. Don't know. All right. Well, God bless the legal system.
Well, now I'm here. We can talk about bladder infection.
Yeah. So we're going to talk about bladder infections, urinary tract infections. I'm surprised we haven't covered this topic yet in 4 years on this podcast, as it's a really sort of common gynecologic situation.
Yeah, I think it's probably one of the most common concerns patients come in with when they come in for especially a same day and more urgent add-on visit.
Right, because they can be quite uncomfortable.
Yeah, disruptive. Anyways.
So we're going to talk about that, try to sort through, sort of the basic questions like what are we talking about? What is it? How does someone get them? How does someone prevent them? How does someone treat them? How do you know if you have it? When do you go to the doctor? When do you not? All those. And then we're also going to try to make sure to differentiate sort of a typical gynecologic situation from when someone is pregnant, when it's a little bit different in terms of how we manage them. So unless we say otherwise, we're talking about non-pregnant state, sort of standard lifetime of women. And then when we get to pregnancy part, we will say like, this is specific to pregnancy, just as a, to give everyone an outline of what's to come. So how would you describe or define what a urinary tract infection is or what a bladder infection is to patients?
A urinary tract infection, it actually is I think we throw that term around, but it includes bladder infections and kidney infections. And just to talk about them separately, a bladder infection is basically when a bacteria that usually from the vaginal anal area gets into the bladder where it's not supposed to be and grows. And the symptoms of that tend to be pain with urinating, sometimes seeing actual blood in the urine, needing to go to the bathroom much more frequently, like sometimes feeling like you need to go to the bathroom every 10 minutes. It's usually pretty obvious, and it can hit pretty quickly. A kidney infection is when that infection then moves up through the ureters, which connect the bladder to the kidney and infect the kidney, which is obviously much more serious. And when that happens, in addition to everything I just mentioned, usually there'll be a fever as well, generally feeling really sick, nausea, vomiting, and what we call the flank, which is basically the part of the back that's kind of a little bit more mid-upper back, a little bit on the side, where the kidneys are, will really hurt. That's thankfully not as common. Most of the time when patients call and come in, it's because they're having the symptoms that I mentioned, just the pain with urinating, or they've seen blood in their urine.
Right. So in medicine, we always try to give things more complicated terms than are needed. So we say like frequency, which means going a lot. We say urgency, which means you really feel like you have to go. We say dysuria, which means it hurts when I pee, like burning and itching. And then there's the sense of not feeling like you emptied your bladder completely.
Yeah.
Like you went and you're like, I still have to go, that sense. And it's just because the bladder, right? The reason people normally have a sensation that they have to pee is the bladder sort of gets distended, it gets filled with urine, and that sort of stretch on the bladder wall, there's a signal that goes to your brain that says, I have to pee, right? And so that's sort of what happens typically. And then if your bladder wall gets inflamed because of the infection, it's sort of always sending that signal to your brain. So you always feel like you have to pee, it's like inflamed, it's irritated. And then even though you go, you still feel like you have to go. And then sort of the burning while you go is because the pee that's sort of going through the urethra sort of irritates it. It's just a lot of irritation and pain from the infection. Now, if someone has a bladder infection, are we treating it because only just to make them feel better? Or is there a risk of everyone with the bladder infection who's not treated, it going up and ascending to the kidney and causing a kidney infection, which you said is much more serious medically?
Yeah, bladder infections are something that we want to treat, because if it does move up to the kidney, that can actually, besides being much more unpleasant and feeling even more awful, that can actually be risky. Someone may require hospitalization. The infection could spread to the bloodstream. I mean, that's way down the line. But I actually recommend, if someone's having these symptoms, not just to, look, hydrating is always good. There's a lot of remedies that people will sometimes, supplements that they'll hear about for bladder infections. But I always recommend seeing a doctor and at least giving a urine sample, and depending on how uncomfortable you are treating it, or even at least just waiting for the urine culture to come back to make sure it's a true infection. Because if there's actually really bacteria that is significant, you would want to treat it. It's not just for comfort.
Right. And what's a little bit interesting about the bladder is that if someone has no symptoms whatsoever and you have them pee and you send a culture, you often will find bacteria in the urine, meaning the urine isn't always sterile, that there's no bacteria in there, and it often is, but sometimes there is bacteria in there. And even if it's at a reasonably high amount, if someone has no symptoms, we don't typically treat because usually the body clears it on its own. So it's important to differentiate non-pregnant women that when someone comes with a bladder infection, it's not just that there's bacteria in the bladder, it's that there's bacteria in the bladder and they have symptoms, right? That's the difference between sort of the fancy term is asymptomatic bacteriuria, which means you don't have symptoms, you have bacteria in your urine, versus an infection, which means it's clinical, that you actually have symptoms from it, that we know that the bacteria have sort of invaded the bladder wall and caused that irritation. And so those we treat, whereas the asymptomatic without symptoms, we typically don't treat because that will usually just clear on its own, or sometimes it's not a true infection. Maybe the bacteria is not actually in the bladder, but maybe it's something that just when you peed in the cup, it's from the vagina. And so there's a lot of overlap between those two, but we generally don't treat unless there's symptoms. In pregnancy, it's different. We do treat it, this bacteria in the bladder in pregnancy, because pregnant women are more prone to get a kidney infection without the bladder symptoms. So that's like an exception. But for most women, it's really only if you have symptoms that we would check a urine culture and treat if it's positive.
Yeah, and it's interesting because I don't usually routinely just check urine cultures when I have someone come in for an annual gynecologic checkup. If they're feeling totally fine, they're having no, abnormal bladder issues. Every once in a while, I'll have a patient who, saw a primary care doctor and had, a urine culture, and they'll bring me the results, and it will have showed a small amount of bacteria, and they're feeling fine. And I'll say to them, I don't think you need to jump on, and get antibiotics right now. If you wanted to repeat this again, it could be that the sample maybe wasn't sterile enough. Sometimes if it is a bacteria that does normally cause a bladder infection, like E. coli is the bacteria, I never know how to pronounce it, Escherichia coli or something, E. coli. Still, if it's a small amount, it could very well be, like you said, that it probably just may have washed out and they're feeling fine. Pregnancy is obviously an exception. So I don't always just send urine cultures on, otherwise healthy, non-pregnant patients who are feeling fine just to check. Exception is even if someone's not having pain, if someone says, I've suddenly started going to the bathroom like every 10 minutes, that would trigger me to get a urine culture. But I don't think it's a good idea to just look when someone's feeling not feeling anything. Right.
Because sometimes, with antibiotics, if you treat things that don't need to be treated, it could be a wash that no harm, no foul, like you didn't need to do it. But it could also then cause problems, right? If you were just healthy and decide to take an antibiotic for 10 days for no reason whatsoever, it could do nothing to you, or it could start messing up other things. You can get a yeast infection. You can start getting sort of drug resistant bugs in your body. There are downsides to taking antibiotics. And so we give them if they're needed, right, to treat something, but we try to not give them if they're not needed so you don't get any of the downsides. And so that would be a case where commonly people are prescribed antibiotics when they don't really need them if they have some bacteria in their urine but don't have any symptoms. Again, non-pregnant. When you're pregnant, we do check routinely and we do treat routinely because, again, pregnant women are at a much higher risk for getting. So I guess actually that begs the question. Number one, why are women more at risk to get bladder infections and urine infections in general? And then two, why are pregnant women more likely to get kidney infections than non-pregnant women?
So just answer the last question first.
Last question first. I will go backwards.
So during pregnancy, the ureters, which carry urine from the kidney to the bladder, tend to get more dilated. And urine just moves a little bit more slowly through them into the bladder. And because of that, it's a little easier for bacteria to basically go upstream, because normally it's like, if you're trying to go upstream on a river, it's kind of hard to if the current's going really fast. But in pregnancy, just to kind of carry that metaphor through, if the ureter is like a river, the urine is like kind of moving more sluggishly. And so if someone has an untreated bladder infection or even just bacteria in the bladder and it hasn't even started to cause symptoms yet, it can just get up into the ureter and get up to the kidney more easily because it's not getting flushed out.
Yeah.
And I've seen pregnant patients basically feel fine and then just get a kidney infection. Like they never even had the bladder symptoms.
Yeah.
It happened so fast. So it's not even like they had an untreated bladder infection. It almost like it was a bladder infection for like maybe a few hours and then it already had spread to the kidney. So that's the issue with pregnancy.
Right. And then why women more so than men for urine infections?
Yeah. So for women, the urethra is shorter in women than in men. So it's just also easier for bacteria to get into the urethra, into the bladder altogether. Because, everyone gets bacteria all the time into the urethra. It's pretty common. And it just, as you urinate, some gets flushed out. If you're well hydrated, you'll urinate more, it'll flush out more. But because the urethra is shorter in women, it just is able to get into the bladder more quickly.
Right. Are there any amongst women risk factors for getting urine infections, like some things that make it more likely or some things that people should watch out for potentially?
Yeah, definitely. Again, for non-pregnant women, one risk factor, just going back to what we were talking about, having what we call vaginal atrophy or very basically low estrogen levels, either from breastfeeding or from perimenopause or postmenopause, makes the tissue around the urethra also very thin. So the low estrogen doesn't just affect the vaginal tissue, it really affects the tissue also in the opening of the vagina and the urethra. And that alone can significantly increase the risk of getting a bladder infection because the tissue is just much drier and thinner and bacteria can latch on more easily. So I've had patients breastfeeding and postmenopause that I've actually recommended vaginal estrogen cream if they keep getting recurrent bladder infections to treat that, which, and for postmenopausal patients, especially elderly patients, it can actually potentially keep them out of the hospital.
Right.
It can keep them from getting, from eventually even getting a kidney infection. So that's one risk factor, is what we call, again, vaginal atrophy, or just thin, dry vaginal tissue that happens with low estrogen levels. Another is just for general hygiene. The vaginal and anal area is full of normal bacteria. There's a bacterial balance there. Most of the bacteria that cause bladder infections tend to come from the gut, E. coli being the most, common one. It's not normally in the vaginal area, but in general, one of the classic things that I remember being told by my pediatrician is always wipe front to back, because you're pushing the E. coli bacteria away. And, sometimes, especially kids, they wipe the other direction and it pushes E. coli into the area of the urethra. So just generally being mindful of that, basic cleanliness is should help most people. It's not like, I don't tell people who have recurrent bladder infections, actually, it's probably not a good idea at all to aggressively wash that area. If you basically just shower regularly, you should be fine. You don't necessarily need to wash the area with soap if you have recurrent bladder infections, because that actually can create other bacterial imbalances. And then also for women, just having vaginal intercourse can increase the risk. Some women will get bladder infections specifically after intercourse because bacteria just gets pushed into the urethra. And again, the urethra is shorter in women than in men. One thing that can help with that is emptying the bladder right after intercourse, but some women even need to actually take an antibiotic right after intercourse to prevent that from happening. And again, that's something that I'll do if this is really just a very routine, regular thing. Not everyone needs to have an antibiotic every time they have sex, but that's another risk factor, is just, again, having vaginal intercourse. But there are many people who get these infections who have no particular risk factors. It just happens. It's a part of everyone's life at some point.
And then there's obviously other times when it's much more common, like people in the hospital are more likely to get them. You have a catheter put in your bladder, it's more likely to happen. Again, those are unusual because it's not something that happens on a typical day for people, but those are other risk factors. So if someone suspects they have a bladder infection, right? They're like, oh, I have pain when I pee and I have bladder pain, whatever. What do you recommend they do? What should they do at that point? Should they go to an urgent care? Should they call their doctor? Should they try to do something at home? What would be your advice to them? This is it, listeners. Here we go. This is what Sara thinks you should do.
So I think that you should if you have a gynecologist or primary care doctor, call them or go to an urgent care. I usually will start, if it's a Sunday and someone's calling and they're in a lot of pain and they're having blood in their urine and it's really obvious that it's a bladder infection.
Right. Just over the phone.
Just over the phone. It's classic. And it's not there's been this, they've had this going on for a month. I'll I'll go ahead and treat them just preemptively. I'll obviously check their antibiotic allergies, but I'll send in an antibiotic just, for their comfort. Because on Sundays, obviously, our office is closed.
Right.
The most ideal situation, yes, it's great to get a urine culture sent. And I'll say if there's an urgent care where you could leave a urine culture or a lab open, by all means do that. But I don't wait necessarily till Monday if someone's really uncomfortable. Also, if it's very obvious, I kind of want to get them treated sooner.
Right.
Like I don't, want them to then wake up Monday and be even sicker.
Right.
So definitely making contact with some medical professional. And if you don't have any established care with a gynecologist or a primary care doctor, go to an urgent care. Like this is the bread and butter of one of the things that they deal with. And they'll also, they'll send a urine culture and they'll also, start you on something if it looks like from the urine dipstick test there, that you obviously have an infection. So that's definitely the first thing I would do.
Right. So let's play that out. So let's say they call on the phone and they have an option to come into the office, get a urine culture and this, that. What is the advantage to having a urine culture, having a dipstick, seeing someone before starting antibiotics versus, dude, we're really sure it's a urine infection, just treat me? Like, how do you balance that?
Even though you may know someone for sure has a bladder infection, I don't know for sure what bacteria it is. I can guess, like most of the time it's this E. coli bacteria, but it could be a different bacteria. Also, it could be E. coli that it just isn't sensitive to the typical antibiotic. Like in overwhelming majority of the time, I can prescribe 1 or 2 antibiotics and it's going to completely cover the bladder infection and they'll feel better. But leaving a urine culture before starting treatment is helpful because let's say 2 days later, I get another call that this patient's on the antibiotic, no improvement at all. They're not feeling better. And they're still peeing blood and still running to the bathroom every 10 minutes. I can then look back at that urine culture, which hopefully will at least have an early result, and check and see maybe it was a bacteria that I didn't expect, or maybe the bacteria that I thought was there is there, but it's one of these multi-drug resistant bacteria, or it's resistant to Bactrim, which is what I I had prescribed. So knowing that, I can then switch them to an antibiotic that would work for them. This is definitely much more important in someone who has recurrent bladder infections. It's unlikely if it's the first bladder infection they've ever had in their life, most likely the typical antibiotic course will help. But I insist more on getting a urine culture if I know someone has had at least a couple other infections in the last few months, because there's more of a chance that whatever they have now could be resistant to something that I typically prescribe.
Yeah, I mean, it's sort of like a little bit of a gamble. I mean, on the one hand, someone calls and they have a typical presentation, typical symptoms, whatever it is, 8 out of 10, 9 out of 10, whatever times, if you say, all right, I'm going to prescribe this antibiotic, they're going to get better. They're going to be done, problem solved, in which case they never needed a culture. They never need to see anybody. But every now and again, we think they have a urine infection, and in fact, they don't. We're wrong, right? It's something else. They have a vaginal infection, or they got some other problem going on, or whatever it is. Or they do have an infection, but it's with a kind of a wonky bug. It's a different bacteria than we expected. And then you're a little bit behind the 8 ball with trying to treat it, because to then have them come in 2 days later and bring in, send a culture. Number one, the culture might be off because you put them on some antibiotic. Number two, it's not going to come back for another day or two. So it's one of these things where, like, on a Saturday or Sunday, if there's no option, okay, you take the gamble because you want them to get better. And 8 out of 9 out of 10 is pretty good. Those are pretty good numbers. But if it's really not that difficult to come in and, get checked, let's make sure it's an infection, send a culture, start you on treatment. Again, 8 or 9 out of 10 times you didn't need to do that, but the 1 or 2 times out of 10 you did, you'll be happy that you already did that. So that's why people sometimes hear different things from doctors about what to do. Sometimes it's like, oh yeah, I treat everyone over the phone, and others it's I always want them to come in. And it's probably some balance of the two that, you have to be a little practical with this as well. If someone's, 2 hours away from, if they're near a pharmacy, but there's no urgent care within 50 miles of them and whatever it is, I'd rather just treat them than have them suffer. But if they can, drop off a culture, it's usually better if it's not too difficult to achieve that.
Brought up something else, which is besides leaving a culture, one benefit of being seen in person is what if it is actually something completely different?
Right.
Sometimes over the phone, it sounds really obvious, but sometimes I'll get calls where someone's having some sort of new pelvic pain that seems like it's in the bladder area and it hurts when they urinate. But from what they're saying, it's not 100% clear to me, like the pain seems to travel. And, could it be appendicitis? Could it be some other type of, a ruptured ovarian cyst? Like there's so many things. So that's why I'm totally fine giving antibiotics if it's like really, really obvious. But if there's something that just seems a little concerning about what they're saying, I'll also want them to come in just so I can make sure, besides just making sure I give them the right antibiotic, like, is it even something totally different?
Right. Okay. Let's talk about Pyridium for a second. So what is Pyridium and when do you recommend it?
So Pyridium is a medication that is basically a bladder anesthetic. It's a pill. And I think there are versions over the counter.
Yeah.
I've prescribed it as well. And it's meant to help with pain control during a bladder infection. It's not meant to actually treat the bladder infection. It doesn't have any role in that. It does turn the urine a funny color. I think a more like orangey type color.
I tell them it's going to look like Tang.
Yeah.
Yeah.
Yeah, I tell them that too, because it can be pretty dramatic.
Yeah. If you don't warn people, they think they're going to die. When they're like, oh my God, I have an infection and now my pee is orange. What happened?
Like first it was bright red from blood, now it's orange. So I'll prescribe it to patients who like with treatment for a bladder infection.
Yeah.
Or I'll tell them to get it over the counter. But I think it's most people have felt that it's helpful for the first day, especially as the antibiotics are just kicking in, because usually within 24 hours of starting the antibiotic, if it's an effective antibiotic, most people will start to really feel much better. Yeah. But there's still like that first, 24 hours where it can be pretty uncomfortable.
Yeah. I mean, the Pyridium works quick and it essentially just, numbs the inside of the bladder wall so you don't have a lot of those symptoms. But like you said, it does not treat the infection. So we don't typically say take Pyridium and call me in the morning, right? It's usually like, I'm going to prescribe an antibiotic and why don't you pick up some Pyridium? So for the first day or two, you feel better while the antibiotic is kicking in, and it does not affect the efficacy of the antibiotic. The antibiotic, works whether you're on Pyridium or not. So yeah, that's a good thing. And yes, it is over the counter. I think it's marketed as different things over the counter, something that's called Bladder, something, relief.
Right. Bladder relief.
Yeah, it's usually like I think a brown type pill that you swallow by mouth and it turns your pee orange, which again, I don't know if they write that on the box, but I always warn people.
But again, I also tell people like,
still take the antibiotic.
Right. Another take home message also is like, if you're having these symptoms, don't just go get it and then go home and just take that and not do anything else. Like you still like go to the urgent care, call your doctor, at least look into this further. Right.
And then in terms of which antibiotic you choose. So let's say this is before getting a urine culture back. Again, a urine culture, we use it for two reasons. One is to sort of confirm the infection. And number two, it'll say what bacteria it is and specifically what antibiotics this bug is and is not sensitive to versus resistant. So a typical result is it's E. coli and it's sensitive to everything. It lists 10 antibiotics, but every now and again, it'll say it's sensitive to 6 of them and resistant to 4 of them. And so we just double check they're on the right antibiotic. So if we have the culture, very easy for us to pick an antibiotic. Let's say your pre-culture results, right? You send a culture and you know the results, or again, it's over the phone and you're not going to have a culture. How do you choose which antibiotic to prescribe? Again, let's take aside allergies to an antibiotic. Assume no one's allergic to anything.
Yeah, so most simple bladder infections will usually respond to a sulfa antibiotic like Bactrim, which is trimethoprim and sulfa together. And so that's in non-pregnant patients who don't have an allergy to sulfa, because that's how I see it. That's probably my starting antibiotic. It's a 3-day course, twice a day, so it's easy to take. Doesn't have a lot of extra, side effects, and it's most E. coli is sensitive to it. So that's usually the
right, and
choice.
it does not tend to have a ton of side effects or other bacteria issues.
Yeah, less than other antibiotics as far as like gut. All antibiotics are going to probably kill some, gut bacteria, but I feel like I don't have a lot of people having like nausea and from taking Bactrim, at least in my experience. Right. There are if someone, let's say, had a bad reaction to Bactrim or or if they had an infection in the past that wasn't sensitive, like was actually resistant to Bactrim. The other couple options that I'll try will be macrodantin or macrobid is another antibiotic that many bacteria in bladder infections are sensitive to.
And that's pretty much only used for bladder infections. I don't think it's used for anything else.
I've never seen it used for anything else.
Which is a good thing because it means it probably doesn't do a lot elsewhere in your body. So that's good.
There's another category of antibiotics called cephalosporins. Keflex or cephalexin is something that some people might be familiar with. That is not my first choice necessarily. There are more bacteria that may not be sensitive to it, but I'll sometimes start with it if there's multiple allergies. So that's another option as well. Now, there are even stronger antibiotics that I don't jump to right away, but in someone who has their culture comes back with E. coli that's resistant to Bactrim and, macrobid, Cipro or ciprofloxacin, what are called the quinolone antibiotics are usually, many bacteria are sensitive to them. They're very strong antibiotics and they can have some pretty significant side effects. Definitely need to be used if someone has a bladder infection that is not sensitive to anything else. But I don't that's not the one like on the weekend, I'll just say, okay, here, take some, Cipro.
Right.
I really want to have a culture that shows that I need to give that antibiotic before I just prescribe it.
What about for a kidney infection? So the fancy word is pyelonephritis. What would you give for that?
So, and that's kind of interesting. I'm assuming, again, we're talking about someone who's not pregnant.
Not pregnant for now. Yeah.
Not pregnant. Also will prescribe actually similar antibiotic choice, but for a much longer period of time.
Right.
So I've prescribed patients, I believe I prescribed patients Bactrim before. I had someone recently who I treated, but it'll be a 10-day course of the antibiotic. And again, culture is really important. I would not give Keflex would be, unless you have a culture that shows it's sensitive. That's definitely for pyelonephritis. I probably would not start with that because just a little less likely to cover the bacteria.
Right.
And that may be where also the quinolones, might be a good choice because in someone who's not pregnant, overall not immunocompromised, relatively healthy, and is able to eat and drink, they can take antibiotics and stay at home and not have to go into the hospital.
Right.
But you do want to be a little more aggressive and treat them longer because if there's no improvement, you definitely would want to bring them into the hospital. So you don't want to set them down a road where they start something and it doesn't work and then they have to get admitted.
Yeah. I mean, a bladder infection pretty much never brings you into the hospital, and a kidney infection absolutely could. And so some people with kidney infections are very sick and do need to be hospitalized and given intravenous antibiotics and all those things. Non-pregnant, often, like you said, not so bad. You can treat them as an outpatient, maybe a stronger antibiotic, maybe a longer course, this or that. This is another one where pregnancy is a big difference, right? If someone's pregnant and has an infection in their kidney, I would say more times than not, they're in the hospital because they tend to be much sicker. And they tend to need like stronger antibiotics, intravenous, like they need a little bit more support. Again, there are pregnant women who have pyelonephritis and aren't in the hospital, but much, much more likely to need to be in the hospital if you're pregnant. It's a much bigger deal.
Yeah. I mean, I think if I ever see someone who's pregnant, I think that's what's going on, I usually will just admit them.
Yeah,
because I feel like just because of everything we talked about with the sluggishness of being able to clear any bacteria out of the kidney, I just want to get them on IV antibiotics right away.
Yeah.
And usually once there's a significant improvement, like there's either kidney tenderness gets better, they're not having fevers, like you can actually have them leave the hospital. So it's not like someone needs to stay there for 10 days, but pregnant patients can leave and then continue antibiotics just by mouth, and we'll send them home with another week's worth of antibiotics.
And plus then you'll usually have a culture with the result of which bug and what it's sensitive to. I would say that, the biggest differences between non-pregnant and pregnant women is, number one, pregnant women, we will treat bacteria in the bladder if it's over a certain amount, even if they have no symptoms, because they're more likely to get a kidney infection. Number two, sometimes the antibiotics we choose are different if you're pregnant and how far pregnant you are. Often not. They're very, very similar, but sometimes there's a difference. And then number three, kidney infections for pregnant women are much, much more serious on average than for non-pregnant. So those are like the big ones and when it's different. How can someone potentially prevent a bladder infection? Like what's the business with, let's say, drink a lot, have some cranberry juice, cranberry pills? What's the deal with that? Does that work?
So Cranberry will not actually help. Like when someone already has a bladder infection, it won't treat the bladder infection, but it can have some effect on preventing infections, whether it's drinking cranberry juice or actually taking, cranberry extract in pills. So that is something that someone can do if they've tended to be more prone to bladder infections. And again, they're otherwise, there's no reason that's been found. Because just to take a step back, if someone really keeps having recurrent bladder infections, I'll sometimes refer them to a urologist to make sure there's no structural abnormality with their urethra or bladder. So let's say that's not the case. Someone just is more prone to getting bladder infections. Bad luck. Taking a cranberry supplementation, is a safe way that it may in some people help prevent them from getting a bladder infection. Staying very well hydrated as well can help because it just helps flush any bacteria out before it really has a chance to latch onto the wall of the bladder. So that's another another way to prevent bladder infections. And some of the behavioral things I mentioned, again, we talked about earlier, just with hygiene and also just with, if someone happens to notice that intercourse triggers a bladder infection, emptying their bladder after. Also very relevant for healthcare workers who are, have long shifts and go to the bathroom once every 12 hours. Is don't do that. Try every few hours to, if you're able to, empty your bladder. Everyone's different with how much they can hold, but sometimes we hold more than is good for us, or we go longer than is good for us. And again, if you empty your bladder, you are flushing out any bacteria that happens to be, hanging around there. And I've specifically had patients that are residents, nurses, PAs who will say, like, they know when they have a crazy shift and they don't pee all day, they'll get home and the next day they'll start feeling it. That's how if they don't go, that's how sensitive they are. So,
there's a Seinfeld episode about that.
No, I didn't know that.
Yeah, there was, I digress. I think we covered the medical part. There was an episode where one of the early seasons where George and Jerry, they were in a parking lot and they couldn't find Kramer's car because, like a parking garage, and they're walking around and around and around. And they can't find the car because they didn't remember where they parked, because it's before you could have a cell phone and take a picture of what floor you're on. And then George ultimately had to pee, and he just went in the parking garage against the wall, and police got him, and they gave him a ticket for it, a whole fine. And his excuse to them was that, well, I have a condition that if I hold it in too long, I get a problem. And I think he said it was called hyperuretosis. He made something up that. And then I think Jerry got caught with the same thing and gave him the same excuse. It was funny. So there you go. But it's not false, not fake news, just probably not true for their situation.
Yeah, exactly. You shouldn't hold your urine too long. You should be careful about where you urinate.
Just like Sarah's in favor of the jury system, she is also in favor of not urinating publicly.
No judgment there, but just.
Excellent. Awesome. Thank you for coming on the podcast to talk about urine infections, bladder infections. If it hurts when you pee, give us a call.
Absolutely.
Thank you for listening to the Healthful Woman Podcast. To learn more about our podcast, please visit our website at www.healthfulwoman.com. That's HEALTHFULWOMAN.com. If you have any questions about this podcast or any other topic you would like us to address, please feel free to email us at hw@healthfulwoman.com. Have a great day. The information discussed in Healthful Woman is intended for educational uses only and does not replace medical care from your physician. Healthful Woman is meant to expand your knowledge of women's health and does not replace ongoing care from your regular physician or gynecologist. We encourage you to speak with your doctor about specific diagnoses and treatment options for an effective treatment plan.